Hi there, I'm Dr. LePage, and I've been asked to come and speak to you today about lupus from a different perspective, from the perspective of basically what you can see and what you can't see. So looking at the more invisible aspects of lupus and the psychological aspects of it. So that's what we'll be talking about today. And just to start with, as you I'm sure all know, that managing pain and fatigue, or managing your lupus symptoms, takes far more than medication, and it can take multiple specialists as well. So we're going to get into that in more detail. But what I like to do is start off with the definition of pain, because many people think of it from more of a sensory perspective, but there are many more aspects to it than just the sensory part of pain. So the actual definition of pain, according to the International Association of the Study of Pain, is that pain is defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Now that might sound a little bit convoluted, but I think the important part of this definition is that there is an emotional experience related to pain. So if you can imagine one having pain and not having any emotion tied to it, it would be very difficult to imagine that. So some of the the key points in the definition is that pain and illness, I am going to use these terms a bit interchangeably. So pain and illness, they're always a personal experience influenced by biological, psychological, and social factors. Pain and nociception are different phenomena, whereas pain cannot be inferred solely from just the activity of the sensory neurons. So they may be firing, they may be active, but that doesn't necessarily relate to specifically the level of pain one is experiencing. And through life experiences, individuals learn the concept of pain and illness, and what does that mean to them. A person's report of pain and illness also, their experiences of that should always be respected, because again, it's an individual situation. So the pain illness cycle is basically when symptoms are unmanaged, the person may feel out of control. They may feel like it can lead to a downward spiral where there's first the disease process or the pain. Often people that are experiencing these things can feel tense, a lot of tension and stress. Those two often go together. There's often fear, anger, and frustration as well. Depression can also be a very common part of it. And of course, with lupus, fatigue is another major component. So this is sort of a vicious cycle that can continue and go into a sort of a downward spiral if not addressed appropriately. So trying to understand pain more specifically. So normally pain is an alarm system responding when body tissue is damaged or about to be damaged. However, pain responses may not always accurately reflect what's happening actually in the body, what you're experiencing. So for example, we've all had a paper cut. We've all had perhaps something heavy drop on our foot. And in the moment, we can feel an extreme amount of pain, but there can be little to no damage. So in that situation, pain isn't necessarily reflective of damage. However, in other situations, sort of opposite situations, there can be a lot of damage and the person may be experiencing pain, but their behavior and emotion may not necessarily reflect it. So one example was, I'm sure that everyone's heard of Tiger Woods, the very famous golfer. So apparently in 2008, he was in one of the major tournaments and he had 2 stress fractures and a torn ACL. And I don't know if you've ever experienced it or you know someone who has, but anybody who has, or any orthopedic surgeon can tell you that these are extremely painful conditions, and there is damage. So both are present, but somehow he managed to actually finish off the tournament and win with these injuries and not having had them looked after. So somehow he managed to get through them. Again, so sometimes our body can manage that pain somehow from various perspectives until we feel safe, until we feel that we have reached safety. Another example, there was a movie years ago called 127 Hours, and it depicts an actual true circumstance that occurred where a mountain climber had some rocks falling while he was in a small area, and he got his arm caught in a very heavy rock, and so his body was basically wedged between two very heavy rocks, and he could not get himself free except for if he could cut off his arm. And literally that is what he did. He cut off his arm, and he apparently reported after he made it to safety that he only felt the pain after he reached safety and collapsed. So pain is a very interesting concept, and there are many different and strange sort of situations and examples that you probably know yourself as well. So trying to understand pain and illness is obviously very important in managing your lupus. The other thing about the brain and pain is that brain is constantly bombarded by signals, and the brain decides which of those to respond to. They usually respond to danger signals, and we tend to ignore the things that are not dangerous, that we perceive as not dangerous. And so when pain is ignored in some situations, your system might speak louder to get your attention, basically, and the pain signals may become more prevalent. So our alarm system can sometimes become oversensitized in those situations, and there are techniques that can calm it down. So the example that you have here is a smoke alarm going off. So if you can think of it that way, sometimes if you're feeling pain, there may be no danger, there may be no damage, but the signals are firing anyway. So, it could just be toast burning, which isn't pleasant either, but the house isn't on fire, basically. So being able to determine when are those signals ones that you need to respond to, and when are they ones that you can ignore, although I'd say it's probably impossible to ignore the pain signals, but what can you do with the ones that don't signal damage or danger? So another important concept to be aware of is the role of fear in pain. And so often when people, when you know what things may cause pain, you can develop a bit of avoidance to things that may not necessarily cause pain as well, because you may be generalizing a lot of things and become very fearful of experiencing more pain, which is totally understandable, and avoidance is a very fast way to eliminate that. But it also leads to potential disability, because then you may be not using your body, and then you become more deconditioned, which then can cause more pain when you do try to do things. But there can be catastrophic misinterpretations. That's sort of a term that psychologists like to use when it comes to the fear avoidance model. So you catastrophize what would happen if if something caused more pain for you, or if you were feeling more pain. And again, pain and illness are also very strongly tied to our perceptions. So pain and illness is not really about the amount of tissue damage you have or damage, and it's also not about the degree of pathology that's seen necessarily on an X-ray or in blood tests, but it is about the unique way that each person experiences pain, our perceptions about pain and illness, our previous experiences regarding pain, our family background. What did we learn from our parents, from our family, our siblings, in terms of how to deal with pain and illness? Do you push on? Do you take care of your symptoms? What do you do? What have you learned are the things to do when you are experiencing any form of illness or pain? Our personality is going to play a role as well. Gender plays a role. Religion and culture, many of these factor into how we actually perceive and then deal with and continue to cope with whatever our condition is. So our beliefs, our emotions, and our behaviors play a very large role in the outcome. So beliefs and catastrophizing, kind of back to that we spoke about a few minutes ago, is that catastrophizing is basically ruminating. constantly thinking through something and repeatedly having thoughts about it, even though they're not really leading to any particular solution, feeling helpless, and magnifying the pain-related symptoms. So this can magnify literally your symptoms. You can actually feel worse as you continue to catastrophize and ruminate. So beliefs can actually influence the perception of pain. Beliefs can actually predict pain, disability, and chronicity more so than disease severity. So there has been research to show that when people are predicting more pain, they actually are more disabled than those people who are experiencing the same level of pain but aren't predicting more pain and disability. And also, in the reverse, reductions in catastrophizing actually predicts decreased pain and disability. So when one is able to manage their catastrophizing types of thoughts and beliefs, it actually leads to being and behaving less disabled and actually slightly less pain symptoms. So this is just a quick image of what one might be happening when they're in pain and feeling like, well, the worst is going to happen. I'm going to end up in a wheelchair and nobody will want me. My family will kick me out, and that will be it. I'll be on my own with the dog sleeping by the couch, and maybe he won't want me either. So we can really become quite catastrophic in our thoughts. So other types of, so in terms of beliefs, other types of dysfunctional beliefs that we may be entertaining when we are ill, when we have a chronic illness or pain, is something, for example, like the all or none type of belief. I can't walk more than 1 hour, so I can't go hiking. So that activity is completely off the shelf. The fortune telling, my kids will never be proud of me again, because I can't be successful. I'm not able to work as I was. So my kids won't be proud. Disqualifying the positive, that's a very common one, which goes along with depression. One good day doesn't mean I will have others. So just because I had a good day means nothing. I'm going to disqualify that nice thing that person did, or the fact that I actually reached some of my rehab goals, because tomorrow is going to be another bad day. So disqualifying anything positive that comes in. It's almost like a filter. Labeling is also another type of dysfunctional belief, so that I'm useless if I can't do things the way I used to. I have many patients who actually initially have those thoughts, that they feel like if I can't do things the way I used to do, I'm useless to my family, I'm useless to my friends, I'm just plain useless. And of course, we know that's going to lead to further feelings of depression, anxiety, and guess what? More pain. The mind reading is also one that is not helpful. And again, this is very common. Can't they tell I need help with the house cleaning? I'm lying here, I look like I'm tired. Can't they help? Can't they tell? And in many cases, they can't tell. And there might be various reasons why. So communication is a very important thing to be able to alleviate that as a problem solving. That kind of thinking or that type of belief. So just being aware if you are using the mind reading as a belief. And then should statements is another common one. The I should be able to make dinner the way I always have. I should. And so again, that's a very dysfunctional belief. If you have chronic illness and or pain, you are not going to be able to do things exactly the way you used to. You are going to have to modify those things. So to believe that you should be able to do them the same way is not correct thinking. It's not accurate at all, and it's going to feed into the pain and disability. So another thing is this is where the the psychological perspective comes in. It's invisible, so pain is invisible. Many of your lupus symptoms are probably invisible. The fatigue is also invisible to some degree. People may see that you look tired, or they may not notice those things. But you can feel invalidated by the medical process, by family, by friends, by coworkers, and it may be challenging to get the support that you need. And communicating your pain can be problematic. Communicating your needs when you're having a flare-up may also be problematic. You might not feel that you want to bother people, and or you feel that they should see that you're struggling. but they don't necessarily. And so there's a couple of images here, the I don't look sick, and then I found one that actually, if you look at the bottom of the second image, it actually says lupus awareness. So it's the I don't look sick and you don't look stupid. Looks can be deceiving. So one of the lupus awareness societies actually had this out. So what to tell others? That's something that often many people are concerned about. What, worrying about what and how much do you tell other people? Beliefs that you must tell all. You must give as much detail as possible in order to be believed, to be credible. Making others understand can be problematic because they also have their beliefs. And if you don't look sick, that's a very strong belief. So trying to make them understand can just turn into a battle that isn't going to be won by either party. Feeling judged regardless of any explanation that you give may also happen. Finding a balance between communicating useful information and maintaining your privacy is very important. One sort of last point on this slide is our experiences, I think, with the pandemic will make understanding whatever modifications you have to make to your routines, I think, a bit easier for you and for other people, because we have all undergone a world pandemic. We've all had to make many changes in our lives. Everybody has made changes, as far as I know, except for my dog probably, but everybody has had to make changes in their life to accommodate for the pandemic. Jobs have been lost. Many things have been lost. Lives have obviously been lost. The way we do business, the way we see our doctors, many things have changed. So I think that when you have to make changes regarding your illness and having flare-ups, I think that now others may have a better understanding of that, because the whole world has gone through a lot of changes because of the pandemic. So in terms of illness and identity, that's another important factor with any kind of illness. Basically, lupus, obviously, one. What have your symptoms changed? Have they changed the way you do activities? Probably. All the time, some of the time, the type of activities that you do, how you view yourself, how others view you, or how you think others view you. That's another important point. So do you define your lupus, or does your lupus define you? That's another very important belief and idea to sort of challenge yourself with and look at. Are you defining your lupus? And if you aren't, how can you? So again, another important factor is acceptance. What is acceptance? A lot of people, when they hear that term, they think about it from a very negative perspective in terms of, oh, I'm just going to accept that I'm disabled now. That's not true. So it's not resigning yourself to the pain, the illness, or the suffering. It's not taking on the role of a patient or a disabled person, and it's not giving up on any pleasurable activities either. It's none of those things. What it is it's acknowledging the reality of the situation. It's quitting efforts that are not working for you. It is selecting workable strategies and meaningful goals. And so acceptance is really more of a moment-to-moment choices that you make regarding your condition and how you move forward. So in terms of acceptance, you want to aim for acceptance, adopting a realistic perspective of life with chronic pain or chronic illness and how it has changed your functioning. So trying to align the way you're thinking and your emotions with your body so that they're all working together. Functional abilities are not an all or none proposition. So whether, how long can I sit? Can I modify my environment? What can I do in terms of being able to function differently? And then what control do you have? So can you influence? You may have more influence over your pain or your illness, your symptoms, than controlling them. But so either way, you can try to turn down or manage your symptoms in various ways. And the picture I have here, just as a little example. So how can you influence things or acceptance? This is more about acceptance. So my dog is the large black one on the left. His name is Dexter, and Ruthie is the little one on the chair. They are 1 year apart, and he's actually younger than her. And they met each other when Dexter was probably a few pounds more than Ruthie and only 12 weeks old. And very quickly he became much, much, much larger than her. But somehow they've learned to accept their size difference, and they've worked out how to have a friendship as a very large and a much smaller dog, and be able to play together and do things together without hurting each other, even though they have this very big size difference. So accepting that although they aren't going to be the same size and they aren't going to be able to play the same way, they can still find a way around those things. So addressing the emotional and the psychological impact of lupus, the stress, the worry, the depression, irritability, feelings of helplessness, sometimes fear of increased pain, and then relationship issues. These are all very common factors that happen in many chronic illness conditions. So how do we address those things? Start listening to your body. You won't eliminate the symptoms, but you can learn to reset the alarm level. So learning symptom management strategies are probably your strongest tools. So literally physical management strategies, emotionally, cognitively, in terms of the way you're thinking, back to the beliefs again. And of course, behaviorally. So what are you doing and what can you do differently so that you are not flaring your symptoms and that you're actually managing them as best as you can? Are you identifying the triggers? And then what can you do with those triggers? How can you manage them? Those are all very important ways of managing chronic illness and chronic pain. And so I don't know if you've ever heard of cognitive behavior therapy, but it's the most accepted psychological approach to treating people with many things, actually: chronic illness, chronic pain, depression, anxiety. It is considered one of the best practices in approach to treating these issues. And so automatic thoughts create an impression of illness that negatively impacts coping. And so what the cognitive behavior therapy focus is the looking at the cognitive processes underlying illness beliefs, and then and also looking at the behaviors that need to be either stopped or modified, and then coping behaviors that need to be reinforced or developed. So that is basically the focus of cognitive behavior therapy, or CBT. So basically what you think and do does affect the way you feel. It absolutely does. So part of what is involved in this is restructuring thoughts. So again, the automatic thoughts of my symptoms are totally out of control, and to restructure that and flip that over to there are things I can do to help my symptoms. Or I can't sit for more than 2 hours, so I can't meet my friends for dinner. Or you could be thinking, I can arrive later, allowing me to better manage my energy level. And then another example would be one good day doesn't mean I will have others. But again, a restructured thought would be one good day means there could be others. Now, of course, each of these thoughts leads to a different emotion. So the thoughts, automatic thoughts on the left, are definitely likely going to lead to worsening feelings of anxiety and depression. And the thoughts on the restructured side of the column are ones that are likely going to lead you to doing things, being more active and managing your symptoms and moving forward with your illness rather than feeling stuck or behind. So again, for symptom management, unhelpful strategies would be accepting disability, avoiding activity, no activity modifications, medication reliance, relying on pain medication, catastrophizing, staying home, and socially isolating yourself. Those are all unhelpful strategies. And so the more helpful strategies would be, for example, challenging your beliefs about disability, setting goals, little goals each day, ones that are very doable. Exercise. There are a lot of really good physios out there that know exactly how to help people with chronic medical conditions and chronic pain so that they keep them moving at the pace that's helpful for them. Relaxation and or yoga has also been found to be a helpful strategy. Problem solving obviously is a very good one, rather than feeling stuck with your problems. Pacing your activities and socializing. Those are all on the helpful end of the scale for symptom management. There are many more, but these are just examples. And one other factor that's very important is sleep, and chronic illness. So sleep problems are often related to pain, illness, anxiety, and inactivity or poor habits. Sleep medication should be considered for moderate to severe or long-standing sleep issues, but sleep hygiene should be reviewed in terms of what are your habits, what are your sleep habits? Are they helping you or are they making your sleep worse? And then acquiring sleep strategies. So relaxation techniques, things like that can be accessed through specialists and through some self-help material, which I'll show you at the end. There'll be some links, but so these are, sleep is also an extremely important part of managing a chronic illness. So just to wrap it up, so, what else can you do? In this cartoon, my therapy is quite simple. I wag my tail and I lick your face until you feel good about yourself again. And so that's what my dog does. And so in terms of self-help management websites, there are a number of self-help management websites regarding pain. Anxiety Canada has a number of things that you can access. There are several depression-related self-help websites. One is specifically male-focused, and you may have seen commercials of that actually locally because it was developed here through psychologists at UBC for men. And then there are several sleep-related self-help management websites as well. So those are a number of resources that you can access that are free online. And then obviously, going through your GP if you want to have a referral to talk to a psychologist or a counselor, going to see a physiotherapist who specializes, has background in chronic pain, exercise management, and occupational therapists can also be very helpful. And those are the strategies that I can share with you. So thank you for being with me.